Imagine this. One day, you feel maybe a little weak, some tingling perhaps. The next, your legs feel heavy. Then, just days later, you could be really struggling to move, maybe even to breathe.
Yeah, it's like your body's own defense system suddenly turns against the very nerves controlling your movement. It can lead to this rapid, really frightening paralysis.
It's a striking and, frankly, terrifying scenario. And it happens to people affected by a condition called Guillain-Barré syndrome.
Exactly, Guillain-Barré syndrome or GBS for short.
And that's what we're diving into today. We're exploring this based on a really detailed set of text excerpts about understanding and managing GBS that one of you actually shared with us.
Right. So our mission today is to kind of guide you through these sources. We
Right.
want to cut through some of the dense medical information and, pull out the essential knowledge.
What is GBS? How does this rapid, sometimes unpredictable thing happen?
Yeah, what are the critical impacts? And importantly, how is it managed? How do people navigate recovery?
We're here to unpack it all with you, drawing directly from this material. So, okay, let's jump right in. First off, the core question. What exactly is Guillain-Barré syndrome?
Well, at its heart, the sources explain GBS as an autoimmune attack. Basically, your immune system, which is meant to protect you, gets confused. It mistakenly targets the protective coating on your peripheral nerves.
The myelin sheath. That's like the insulation on an electrical wire, right? Helps the signals travel fast.
Precisely. And in GBS, this attack causes, well, rapid damage to that insulation. It's not just peripheral nerves either. Sometimes it affects cranial nerves too, controlling things like your eyes or face.
The sources call it acute segmental demyelination
That's the term, yes.
and damaging that crucial nerve insulation.
Mm.
What's the direct result? What do you actually see and feel?
Well, that leads directly to the hallmark symptoms. The most classic one is weakness that starts usually in the legs and ascends, it moves upwards in the body. You also see dyskinesia, that's difficulty with voluntary movements, and hyperreflexia, meaning diminished or even absent reflexes. And then those strange sensations, paresthesias, numbness, tingling, that pins and needles feeling.
So just stepping back for a second. The core idea is your own defenses attacking your nerve insulation, disrupting signals, causing these widespread physical symptoms. It feels like a really powerful and kind of scary biological vulnerability.
It really highlights how delicate the whole system is.
Now, the sources talk quite a bit about why this happens. Is there usually like a trigger event?
Yes, and this is a really critical point from the sources. In a large chunk of cases, they say 60% to 70% GBS is triggered by something that happened beforehand, most often an infection.
An infection,
There's
just like
two.
getting sick.
Exactly. The material we looked at lists several common infections as potential culprits, things like Campylobacter jejuni food poisoning,
Oh, I've heard of that.
yeah, or viruses like cytomegalovirus, Epstein-Barr that causes monomycoplasma pneumonia, H. influenza, even Zika virus.
Wow. And the sources actually noted that one specific bacterium, Campylobacter, is linked to about 40% of GBS cases in the U.S. That's quite specific.
It is. It's a significant link.
So wait, a common infection, something lots of people get over just fine, can sometimes lead to this serious nerve condition. This is where it gets really interesting. The sources mention this theory called molecular mimicry.
Ah, yes. This is a key insight. The basic idea is that a protein on the surface of the bug, the bacteria or virus, looks remarkably similar, molecularly speaking, to a protein found on our own myelin, that nerve insulation.
Okay.
So your immune system gears up to fight off the infection, right? But because of this structural similarity, it gets confused. It starts attacking not just the infection, but also your own nerve coating. The sources specifically mention a target called ganglioside GM1B.
So it's like a case of mistaken identity, but on a molecular level. Your body's defenses accidentally attack you because part of the invader looked like part of you.
That's a pretty good way to put it. This mistaken attack then brings in various immune cells, macrophages, and others. They cause inflammation. They actually destroy the myelin, interrupting nerve conduction.
And potentially damaging the nerve fiber itself, the axon.
Yes, and that distinction is crucial for recovery, as the sources point out.
How so?
Well, the myelin insulation is made by special cells called Schwann cells in the peripheral nervous system. The sources say a critical factor for recovery is whether these Schwann cells survive the initial attack.
Okay.
If they're spared and the underlying nerve fiber, the axon, isn't too badly damaged, those Schwann cells can potentially rebuild the myelin sheath.
Allowing the nerve signals to get back to normal function.
Exactly, which leads to recovery. But If the axon is significantly damaged, that's a different story. The nerve fiber itself has to regrow.
And that's much slower.
Much slower. The sources note this can take months, sometimes even years, and the recovery might not be complete, potentially leaving permanent residual symptoms.
So the extent of that initial damage really dictates the recovery path and the potential outcome. Okay, let's talk about how this typically unfolds. The sources describe a sort of pattern, right?
They do. Usually, that triggering infection we talked about happens about 1 to 3 weeks before any GBS symptoms show up.
Okay, a bit of a delay.
Yeah. And when symptoms do start, like we said, it's most often weakness and maybe loss of reflexes, usually kicking off in the legs.
And then it moves upwards, that classic ascending pattern.
Yes.
Yeah.
And the sources highlight that this weakness progresses pretty rapidly. It typically reaches its peak severity, what they call the plateau phase, within about 2 weeks.
2 weeks, okay.
And they're quite clear. It generally shouldn't progress for longer than 4 weeks.
And what if it does keep getting worse after 4 weeks?
According to the sources we read, if the progression continues beyond that 4-week mark, doctors would likely start thinking about a different condition, something more chronic, like CIDP, chronic inflammatory demyelinating polyneuropathy.
Got it. So GBS is really known for that rapid onset and progression to its peak. And at that peak severity, the sources mention weakness can get so bad it affects breathing muscles and even swallowing.
Yes, and this is where GBS becomes potentially life-threatening. The demyelination, the damage to the nerves controlling the diaphragm and the intercostal muscles between the ribs, can severely impair breathing. Sometimes it leads to respiratory failure.
That sounds incredibly serious.
It is. And damage to the cranial nerves controlling the face and throat muscles, the bulbarachnoids, can cause difficulty swallowing, speaking, or clearing secretions from the airway.
What about other symptoms besides the muscle weakness?
Well, sensory issues are very common too. That numbness, tingling, and sometimes significant pain we mentioned earlier. That happens when the immune attack affects the sensory nerve fibers.
Right.
You can also see issues with nerves controlling eye movement or even vision if the optic nerve is involved. And significantly, the sources point out the attack can disrupt the autonomic nervous system, specifically mentioning the vagus nerve.
The vagus nerve that controls things we don't think about, like heart rate and blood pressure.
Exactly. The sources describe this as autonomic dysfunction. It can lead to really unpredictable and rapid changes, tachycardia, where the heart speeds up, or bradycardia, where it slows down, and wild swings in blood pressure, from hypertension, high blood pressure, to orthostatic hypotension, where it drops when you stand up.
And these changes happen fast.
Very fast, and they can resolve quickly, too. They're described as labile, meaning unstable.
That must add another layer of complexity to managing the condition in the hospital. Now, a really important point the sources emphasize, especially thinking about the potential for widespread paralysis.
Yes, absolutely crucial. Despite how severe the physical impairment can become, the sources are very clear. GBS does not affect a person's cognitive function or their level of consciousness.
So the person is fully aware the entire time.
Fully aware.
Wow.
Yeah.
Imagine that being completely alert, but potentially unable to move, unable to speak. That must be incredibly isolating and terrifying.
It truly is hard to fathom. And, while that ascending weakness is the classic picture, the material does mention variations.
Right.
Well, sometimes GBS might present mainly with sensory symptoms. Other times, the damage might primarily affect the axon, the nerve fiber itself, rather than the myelin. And there's a specific variant called Miller-Fisher syndrome, which typically involves paralysis of the eye muscles, problems with balance and coordination ataxia, and loss of reflexes.
So, okay, given this range of symptoms and the rapid progression, how do doctors actually confirm a diagnosis? How do they figure out it's GBS?
Well, I start by looking for that characteristic clinical picture. The symmetric weakness, meaning similar on both sides of the body, those diminished reflexes, and the upward progression of symptoms.
And the patient's history is important too.
Oh, very important. Finding out about a recent viral or bacterial illness in the preceding weeks is a strong clue.
And monitoring breathing must be critical right from the start.
Absolutely essential. The sources emphasize checking respiratory function constantly, things like vital capacity and negative inspiratory force. These measurements help predict if respiratory failure is imminent.
What about specific tests?
The diagnostic tests mentioned include analyzing cerebrospinal fluid, the CSF, usually obtained via a spinal tap, In GBS, it typically shows elevated protein levels without a corresponding increase in white blood cells.
Interesting.
And electrophysiology tests, nerve conduction studies are also key. They show that nerve signal transmission is slowed down or blocked, confirming the demyelination.
And the sources specifically noted that standard blood tests aren't really used to diagnose GBS itself.
That's correct. Blood tests are more for ruling out other potential causes or maybe identifying the triggering infection, but they don't confirm GBS directly.
Okay, so GBS can be rapid, it can be severe, impacting vital functions like breathing. It makes sense then that the sources call it a medical emergency.
Absolutely. The sources state this very clearly. GBS is considered a medical emergency because of that risk of rapid progression and potential respiratory failure. Patients often need intensive care unit, ICU level monitoring and management.
What's the main focus of care during that really acute phase?
Constant vigilant monitoring is key. Tracking changes in muscle strength and especially respiratory function almost minute by minute sometimes.
And breathing support might be needed.
Yes, respiratory therapy or even mechanical ventilation might become necessary. The sources actually suggest that sometimes it's better to consider elective intubation, placing a breathing tube proactively if breathing muscles are clearly weakening, rather than waiting for an emergency situation.
Makes sense.
Patients are then gradually weaned off the ventilator as their own breathing muscles recover strength. And if swallowing is impaired, suctioning to clear the airway is also really important.
And with someone being potentially paralyzed or very weak, there are other risks just from being immobile, right?
Huge risks. Preventing blood clots is absolutely vital. The sources mention using anticoagulant medications, blood thinners, and also devices like sequential compression boots on the legs to keep blood circulating and prevent deep vein thrombosis, DVT, or a pulmonary embolism, PE, which is a clot traveling to the lungs.
Okay, so that's managing the immediate life threats and complications.
Yeah.
What about treatments aimed at the underlying cause, that immune attack?
Right. The sources discuss two main therapies for that. Therapeutic plasma exchange, sometimes called plasmapheresis, and intravenous immunoglobulin, or IVIG.
How do those work, basically?
Well, they both work in slightly different ways, but the goal is essentially to reduce the amount of those harmful antibodies that are circulating in the blood and attacking the nerves. Plasma exchange physically removes them, while IVIG seems to provide helpful antibodies that interfere with the damaging ones.
And the idea is that these treatments can help lessen the severity of the attack and maybe shorten the time someone is immobilized or needs ventilation.
Exactly. They directly target this mistaken immune response. And alongside that, managing those unpredictable swings in heart rate and blood pressure, we talked about the autonomic dysfunction, is also critical.
How's that handled?
It requires continuous ECG monitoring, watching the heart rhythm. Because the symptoms can be so volatile, the sources note that doctors often prefer short-acting medications to manage things like high heart rate or high blood pressure. Alpha blockers were mentioned as an example. You want something you can adjust quickly.
And low blood pressure.
That's typically managed with intravenous fluids first to support circulation.
Okay, so once the acute critical phase starts to stabilize, what's the experience like then? The sources really go into detail about the ongoing care and the road to recovery.
Yeah, the ongoing monitoring for complications remains important, of course, but the focus definitely shifts, and the sources really underscore the immense psychological impact.
I can only imagine.
The sudden onset of paralysis, the uncertainty, the fear. It's incredibly frightening for patients and their families. Providing really solid emotional support and helping them cope is just essential.
The sheer range of potential needs mentioned in the sources, breathing support, mobility issues, nutrition, communication problems, anxiety, fatigue, it shows how all-encompassing the care has to be.
It really affects every aspect of daily life. So interventions range from helping with breathing exercises and chest physiotherapy to making sure limbs are properly supported to prevent contractures and performing passive range of motion exercises maybe twice a day to keep joints mobile.
And preventing skin breakdown from being immobile.
Crucial. That means frequent repositioning, using special mattresses or padding, and really keeping an eye on skin integrity. Monitoring nutrition and hydration is also vital, not just for overall health, but because they impact skin health and energy from mobility too.
What about communication? If someone can't speak because of the paralysis?
This is so important. The sources stress, again, that cognition is fully intact. So finding a reliable way for the patient to communicate is paramount. That could be anything from picture cards or letterboards to simple eye blinking systems.
Collaboration with therapists must be key there.
Absolutely. Speech therapists are vital. And the sources highlight the deep frustration patients feel being unable to speak or laugh or even cry normally.
The anxiety in that situation must be just overwhelming.
It really is. The sources suggest strategies to help patients and families cope. Things like providing clear, consistent information about what's happening and what to expect. Involving the family in care decisions as much as possible.
Creating a supportive environment.
Yes, a calm, positive environment. Using relaxation techniques, maybe distraction. The sources mention things like encouraging visitors, reading aloud, listening to music, even video calls or watching TV if possible. Anything to maintain connection and provide some focus beyond the illness.
And fatigue. The sources mention that's a big issue, even as people start to get stronger.
A major issue, and often a long-lasting one in GBS recovery. Patients really need help learning to pace their activities. Ensuring they get enough rest is critical. Good nutrition plays a role in rebuilding strength too. But the key thing is that overexertion can trigger significant fatigue. So finding that balance is tough but necessary.
And throughout all this recovery and rehab phase, the healthcare team is still constantly watching for potential complications.
Absolutely. Vigilance is still key. Monitoring for any changes in breathing rate, quality, those measurements like vital capacity, signs like breathlessness or a weak cough. Watching the heart rhythm on ECG, tracking blood pressure, looking for signs of DOT or PE, checking for urinary retention if bladder function is affected, and always monitoring the skin.
So looking ahead towards eventually going home and continuing rehabilitation, the sources paint this as potentially a very long process.
It often is, and a really crucial piece of information that the sources emphasize sharing with patients and families is the generally favorable prognosis.
Right, despite how scary it is initially.
Exactly. While the acute phase is terrifying, educating them early on about the high potential for recovery, that 70% full recovery statistic is so vital for providing hope and perspective.
That statistic must be incredibly powerful against the initial fear.
It really is. So education for caregivers covers a lot how to manage specific care tasks at home, using mobility aids, understanding diet and exercise recommendations, and importantly, ongoing coping strategies for both the patient and the family.
And the rehab itself.
For many, regaining function requires intensive rehabilitation. This might happen in an inpatient rehab facility or as an outpatient or through home-based therapy programs, but the sources stress it demands significant patience and perseverance from everyone involved. It's often a marathon, not a sprint.
And even after formal rehab might end, the sources mention the importance of just continuing general health practices and regular medical checkups.
Yes, maintaining overall health is important for long-term well-being after GBS.
So recovery is really this multifaceted journey. The outcomes listed in the sources kind of reflect that it's not just about getting muscle strength back.
No, it's about maintaining independent breathing, increasing mobility and self-care ability, ensuring adequate nutrition, recovering communication if it was affected, managing anxiety and fatigue, and crucially, remaining free from those serious complications. It touches everything.
Finally, just to put it all in perspective, the sources give us some key numbers on how often GBS actually occurs and the typical long-term outcomes.
Right. The incidence is relatively low, affects about 1 to 2 people per 100,000 each year, and it seems to affect males and females pretty much equally.
And the outcome stats.
As we've mentioned, that encouraging figure, about 70% of people eventually experience a full recovery, regaining their previous level of function.
But that leaves 30% who live with some lasting disability.
That's right. The sources indicate these prominent residual symptoms, maybe some lingering weakness, numbness, or fatigue, are typically seen in cases where there was significant damage to the nerve axons themselves, not just the myelin insulation. Unfortunately, death does occur in a small percentage, around 5% to 10% of cases.
And the main causes of death.
Most often due to severe respiratory failure or complications like pulmonary embolism, those blood clots traveling to the lungs.
So we've taken quite a journey through these sources today. We've traced the path of GBS, starting from what's often a common infection that somehow tricks the body's own defenses into attacking its nerves.
Leading to that frightening, often rapid paralysis.
And then through the critical phase of medical management supporting breathing, circulation, targeting the immune system.
And onto that long, often demanding journey of recovery and rehabilitation.
I think the essential takeaway from all this material is that GBS, while rare and definitely serious, is often triggered by something commonplace like an infection. It causes typically temporary paralysis.
But, and this is key, thanks to really intensive medical support and dedicated rehabilitation, the majority of individuals affected can achieve a significant, often full, recovery.
This deep dive really lays bare how incredibly intricate and sometimes fragile the balance is between our immune system designed to protect us from the outside world and our nervous system, which governs basically everything we think and do. And it kind of leaves you with a profound question, doesn't it? If a seemingly ordinary infection can sometimes fool the body into turning against itself so dramatically, what does that teach us about the complex dance required just to maintain health and maybe the hidden vulnerabilities we all might carry within us?
It's certainly a powerful reminder of the wonders and the complexities of human biology.
Absolutely. Well, thank you for joining us for this deep dive into these sources on Guillain-Barré syndrome.